Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have a great guest with me today, Laura Parra. She serves as a community program specialist at the UF Health Cancer Institute Office of Community Outreach and Engagement. She earned her Master of Public Health from Florida International University in Miami, Florida. And before joining the Cancer Institute, Laura gained experience working in federal quality health centers and the Florida Department of Health, where she's strengthening her skills in community health promotion. In her current role, Laura leads community-based cancer education initiative across North Central Florida. She's deeply passionate about public health and health equity, with a strong commitment to ensure that everyone, regardless of background or circumstance, has access to quality care, education, and the resources needed to live healthier life. Outside of work, Laura enjoys exploring the beautiful springs of North Central Florida, kayaking, traveling, and discovering new restaurants. So, Laura, thank you again for doing this with me today.
Thank you so much, Deadly, for having me.
Perfect. So, can you tell us a little bit about your background and what led you into community-based cancer education?
Yes, absolutely. So, my background is in public health and health education. And I've always been really passionate about the intersection of education and health. I remember back when I was very little, wanting to be a teacher, but really wanting to focus on education and how just people knowing how their body works and the things that they can do to be healthier, just wanting to help people in that way and educating through that. And then what led me specifically into community-based cancer education, which is seeing the need of people. I think the disparities that I've seen in my work and learning about it through my master's program. And then just connecting that with education. If people were more aware of screenings available, how healthy eating and exercise impacts their health, uh, you know, just helping them with that. So I just really wanted to bridge those gaps and make sure people in all kinds of communities have the education and resources they need. So, that's how I found my way into this work. And I really have loved it ever since. It doesn't feel like work to me most of the time because I just am so passionate about what I do. And yeah, I'm just super passionate about educating people and now specifically in the cancer space.
So, wasn't anything special that inspired you to work on bringing cancer awareness and education directly to communities?
I think it's just the idea that everyone is affected by cancer in some way. I know I'm directly affected by cancer, or have been my mom. She is a cervical cancer survivor. So just the fact that she knew about getting her pap smears done, and we encounter a lot of people that know someone that has breast cancer and is now a survivor, and getting that mammogram is what saved their life. So just knowing that people can be educated to know to get that mammogram, and then that could ultimately just save their life, I think is what led me to this work. Just the fact that cancer affects everyone and it doesn't discriminate against your economic status or your race or your age or anything. So yeah.
What are some of the biggest barriers that you see in getting cancer information and this screening access to
Mhm.
certain communities?
So I think one of the biggest ones is access. I think we've seen that throughout in public health in general, just having access to the resources needed. Another one that I see a lot is just the fear and the stigma attached with cancer screenings. A lot of people think that, I'd rather just not know, or that cancer is a death sentence, and
Mhm.
I can just live without knowing. And then just again, the health literacy, the education of I didn't know I was supposed to get a mammogram, or I wasn't aware that, because I smoked for so long, I can be eligible to get a lung cancer screening that might save my life and catch cancer early. So, sometimes the barrier isn't just access like we think. It's trust, fear, and even just not knowing that resources exist or that these screenings are recommended for certain age groups.
Got you. How do you build trust when working with communities that may have medical mistrust or limit healthcare access?
I think it's just showing up and listening is a big thing. Understanding that when you're working in community, that they are the experts and that you're just there to listen and learn from them. I know sometimes working in public health and so much knowledge and all the research that we do and all the, you know, we go to school and we just learn so much. But when we're in community, the community members are the experts. So making sure that they have a seat at the table because they know what their needs are, what barriers they're facing, the lack of access, what resources that we haven't thought about that they may need. So, and then just working with them and not just for them. So we all know that trust isn't built overnight, so it's built when communities see that we're there to listen and not just deliver information or just get what we need and go. So just making sure that they are aware that we're there to help them. We're there for them, working with them. Yeah.
Perfect. Can you share a story of example of how community partnerships have made a real impact in improving cancer awareness or screening rates?
Yes, so I specifically remember an event we did back in April with a church here in Gainesville. So we actually did a prostate cancer ambassador training. So community members and the church members were able to come in and learn about prostate cancer and be able to become an ambassador in their community. So host their own education sessions or even just talk to family and friends about the importance of getting prostate cancer screenings, the age, what it looks like, who to talk to, what questions to ask your doctor. So it's was basically the idea of meeting community where they are. So we know that faith-based organizations are huge in community. They're trusted community leaders. So yeah, bringing the education to them and just using them to empower community so that they can then support their own community and empower their community as well. So it's just like that domino effect of educating one person or a group of people that can then go ahead and educate more people and it just kind of trickles. So, yeah.
Yeah. What are some of the most common myths and misconceptions about cancer that you encounter in your work?
So, like I mentioned earlier, some myths that I come across all the time when I'm working in community is I feel fine, I don't need a screening. Usually it's men. I know men usually have a harder time going to go see their doctors, and it's usually the women in their life. You have to go get your screening. I know you feel fine, but it's important to get screened. You just never know what's going on. Another one is I would rather not know. I see that a lot, especially with people and families that take care of that they're like the caretaker in the family um that they would rather not know. So I turn it back on them and I'm like, well, wouldn't you know now to be able to get the treatment you need to be there longer for the family that you take care of. So, yeah. So, we always want to address those myths and misconceptions with compassion and facts. Education is very powerful because when people understand what screening really involves, the fear starts to fade. So.
Okay. Is there a specific type of cancers where community education had a particularly strong impact on early intervention or
Mhm.
early detection? Sorry.
Community education has had a particularly strong impact on several cancers, especially those with established screening tests. So when we think about mammograms, colonoscopy, at-home colorectal cancer screenings, or the kits, Cologuard, those that you have heard about. Pap test as well for cervical cancer. So, in my experience, education really makes a difference across most cancer, but it's especially powerful when we're able to connect people to screenings that they may have not known about or have had access to. So, yeah, education is important for all cancers, but we see the strongest impact in cancers where early detection tools exist, like the ones I mentioned and where awareness and access can literally change someone's health journey or actually save their life if the cancer is caught early.
How can healthcare professionals better communicate with patients and families about cancer prevention and screening?
So, when thinking about healthcare professionals, I think just treating patients like humans and listening and being aware of any cultural norms and just be very culturally sensitive. I know in different cultures, people don't tend to like to talk about cancer or just health in general. So just being very careful and aware of how you're speaking to patients and listening. I think that's a big one for
Yeah.
for physicians, healthcare professionals. They don't have a lot of time in the room with patients. So just trying to just really focus in on that patient, listen, and then a main one for us if you're talking about health education is using plain language, knowing that your patients might not understand those big medical terms that you use on your, as a doctor, as a medical professional. So just making sure that you're using uh,
Yeah.
words, plain language for, when speaking with patients.
Yeah, yeah. I think that's really important. Sometimes we do a lot of education with our patients here in the clinic, and sometimes it's something that I reinforce a lot with my students. It's like, you really need to go very line words and depending, try to meet them where you think they are at, right? And sometimes we are thinking somebody is in a certain level, but they're not there. So just really make sure that you either don't give like 10 words, but just two specific words, and or bring a caregiver with them or their significant other. So it's like more people can understand what you're trying to say.
Exactly.
I think that's important because sometimes the patients just gets overwhelmed. So a lot of the time I hear from patients like, I went to this physician and they're amazing and they really know how much they know, but I have no idea when he started throwing to me all these research papers and da 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 until, the resident comes and really kind of give me two, three line words that I understood what I was needed to understand to make me feel comfortable. So I think,
Yeah. hmm I also the teach back method. I think we learned that in when I was doing my master's program is allowing the patient to then rephrase what you just told them to
yeah.
see if they really understand. And language, making sure that if possible, you have a provider that speaks that language or just having materials and things in the language, the native language of your patients. So, yeah.
Yep. How has technology like social media, telehealth, community apps changed the way you educate or reach people?
So technology has really changed everything for us. It lets us reach people we might never see in person. So when thinking about social media, it's easy to share something quick on a post or something about the importance of getting your mammogram, the screening guidelines, or even if it's like a cancer awareness month. I know we like to do that at the Cancer Institute, kind of do it's October, Breast Cancer Awareness Month. Make sure you're getting your mammograms, and just share like a quick resource with that. We've also doing more virtual sessions. I know that you attend our Cancer Connections sessions. So things like that where we're just able to reach people and it gives everyone the flexibility to join from wherever. And then also just, this podcast is a great example. It's another way we can get important information to people in a way that just feels accessible and convenient.
Okay. What future directions or innovation excite you the most in community-based cancer education?
So one of them, and I'm going to give our office a huge shout out. So we have our mobile cancer screening unit. Yeah, the connector, as we call it, or in office we call it Connie the connector.
Oh, I love
Um,
that.
yeah. So we were able to provide mammograms. We have a full mammography machine on the unit to do that. We can also do pap tests on there if we have a provider, PSA testing as well if there's a provider on board, things like that. So, we can literally travel to people, make sure that they have the access that they might not have usually in their communities. We can just pull up and then just do the mammograms there. So it's breaking down those barriers. And then another one, of course, I know AI has been a super hot topic recently. So I'm excited to use AI as a tool that can actually enhance what we do. So helping us create materials faster, tailoring education to different languages or cultures, or even creating like an AI app for to help people figure out what screenings they may be eligible for depending on their age. So, it obviously doesn't replace the human connection that we have face to face, but it can make our outreach more efficient and honestly personalized and more culturally tailored to different communities.
So now that you're talking about tests and people that who can be eligible, do you know any information? I hear that quite a bit from patients, mainly on the breast cancer population, like BRCA, right? If I have a history of a breast cancer from a mom or an aunt and I want to run a test, I'm eligible or not. Do you know anything about that?
So that would be genetic testing to see if you have that BRCA gene.
Uh-huh.
I would encourage listeners or just participants to talk to their primary care provider to see if they can get connected to those specific genetic testings.
Okay.
Because yeah, uh, breast cancer is, you know, you could be higher risk if you do have those genetic mutations. So it is always important to talk to your provider and see if you're eligible or if it even makes sense for you to get those genetic testings.
Okay. What is one piece of advice of encouragement that you give to listeners who want to get involved in cancer awareness in their own communities?
So I think my biggest recommendation would be to just start with people around you. Telling your loved ones, hey mom, did you get your uh mammogram done this year? Have you talked to your doctor about that? The guys in your life, once they reach a certain age, they need to start getting those screenings done. So, talk to your loved ones about getting screened and the importance of it. And, those simple reminders can make a huge difference. And then also, educating your community doesn't have to be that complicated, sorry. Just sharing reliable information, supporting local health events too could help. And then, or just connecting someone to a resource they didn't know about. So, every small action matters and your voice can truly help someone get the care they need. So I think just starting small, talking to the family and friends about the importance of getting screened. I do it all the time, and I'm sure my family is very annoyed, but it's small but very impactful.
Have you ever come across somebody who is like, I don't believe in that, mammograms are not good for you because you get radiated all the time? Like, how do you respond to that?
We do unfortunately encounter people like that, and it's okay, but I think it's just like I said, talking to them with compassion and just stating the facts. Leading with facts, I think, is very, very important. And then just assuring them that, this is a conversation that they can have with their provider. And, people get mammograms done all the time, and it is just like early detection does save lives. So I think just encouraging, not trying to correct, but just leading with facts.
Okay. Okay, perfect. That was great. Thank you so much for this all wonderful information. I'm glad that we connected again. I meant to do that for a little while. I enjoy, and even though many times with cancer connection is for patients, and a lot of the, yeah, most of it is for education towards patients, but I always learn stuff. That's why usually when I can, I'm there. You guys bring great speakers, and it is always something great to offer. And sometimes I find things that I didn't know that I can then educate my patients. By the way, going to this, they're having this monthly, right? You guys have
Yeah.
cancer connection
Mhm.
monthly.
Yes.
Go to that. You learn a lot from it. We used to do it in person. I see how virtual can reach out more people, but definitely I miss the one to see you actually, and the one-on-one interaction. I think that was nice, but I get
Yeah.
it, right?
Mhm.
Times change, and again, it's nice to be able to reach out more people, but yeah, I just kind of miss a little bit like that one-on-one. Same thing with tumor boards. We say that all the time. You go
Mhm.
back into person because you just don't see the people anymore. Everything is just a screen, and or you hear the voice, and that's it.
Yeah, I agree. And thank you so much for letting me know how much you enjoy Cancer Connections. I'm always very excited to host monthly. And we are trying to bring some of them back in person, once or twice a year, maybe. So we are exploring that possibility of bringing them back in person because I do think it's very important. Just a human connection. You can meet and you can also network there too, and then just talk to the presenters, and yeah, so that is something that we're hoping to do in the future.
Excellent, excellent. Well, Laura, thank you so much for doing this with me. I really appreciate it.
Of course. Thank you so much for having me.
All right, you have a great rest of your day and week.
Thank you. You too.
Okay, bye.